So I'm a strong proponent of knowing what you're dealing with so that you can make appropriate informed choices regarding your care. So as part of that, genetic testing is a big thing that's taken a life of its own nowadays. It's a very scary thing for patients to be able to think that they have a genetic mutation over which they have no control, which itself is dictating what happens to them. So it's scary for the patient. But I always come down to basics. If you give the patient the necessary knowledge that they need and the tools that they need, then they can make good decisions. And you can make it with them and decrease the fear of something unknown to them. So I feel very strongly that patients should get genetically tested when appropriate. Previously, we used to have big algorithms to choose the kind of patient who needs to be genetically tested, and we do that as a matter of fact in our offices. We pick and screen patients who need genetic testing and afford the testing to them, and then treat them appropriately. However, there are some recommendations nowadays that all women should consider being genetically tested because we are only sort of scratching the tip of the iceberg and only detecting some of all the patients in the community who might have a genetic mutation. So I'm a strong believer in offering genetic testing to as many patients as possible, either using the guidelines or other family history or fears and considerations that there might be. I do feel it informs us on how to treat the patient appropriately, and I feel very confident even counseling patients on the pros and cons of genetic testing and how it could affect them in the future. So patients usually know about two main mutations called the BRCA1 and the BRCA2 mutations that are very strongly linked to breast cancer. However, the field of genetics has exploded in the last few years, and now there's a whole gamut of genes that can be associated with not only breast cancer risk, but other associated cancers, including colon cancer, melanoma, lymphomas, and other such cancers. So I feel it's really important to do genetic testing to catch all the mutations that might be linked to cancer. This can help us tell a patient how they should be screened for cancer, and if they have cancer themselves, how appropriately to be treated. It increases their treatment options if you have genetic testing and you're able to even talk to them about maybe major surgery to prevent a second cancer. The other thing is that when you do panel testing on patients, you might detect other genes that code for other cancers, and then you can make very clear recommendations for cancer surveillance to the patient herself, as well as within the family, because other patients in the family or other people in the family may need to be tested. So you're really providing very comprehensive care to everybody who might have a mutation. So I do feel panel testing is important, and detecting all genes that might be connected to cancer or otherwise are important.